In October 1975, before we were married, Phyllis was living with her parents in Forest Hills, Queens, New York. One morning, they found her semi-conscious and unresponsive. When she finally came around, they took her to see Dr. David Papier, their family doctor. Dr. Papier examined Phyllis, and he then referred them to Dr. Robert Carlin, a neurologist in the area. Dr. Carlin performed a spinal tap, and he found blood in Phyllis's cerebral spinal fluid. Dr. Carlin then had Phyllis admitted to Booth Memorial Hospital in Queens. There, he had 2 cerebral angiograms performed, one that highlighted the arteries on the left side of her brain and one that highlighted the arteries on the right side of her brain. The angiogram of the right side of her brain showed a large berry-aneurysm, or a bubble, on her right internal carotid artery at the base of her brain. This is the most common location where these aneurysms occur. Dr. Carlin then referred Phyllis and her parents to Dr. Sidney A. Holland at Mount Sinai Hospital in New York City. Dr. Holland had an angiogram of only Phyllis's right internal carotid artery performed. The reason this was done is in about 20 to 35% of all berry-aneurysm cases, there is more than one aneurysm on the artery, so Dr. Holland was looking to see if there were any additional aneurysms. When the test was completed, Dr. Holland said that they had a definitive diagnosis, that it confirmed the diagnosis of the one large berry-aneurysm, and Dr. Holland said that he could cure Phyllis of it. By performing a craniotomy and clipping the aneurysm, he could cure her of the aneurysm. By placing a surgical clip across the neck of the aneurysm, it seals the bubble and cures the patient. This procedure is still in use today. On November 12, 1975, Phyllis and her parents consented to have the surgery done. On November 13, 1975, the following day, Dr. Holland, Dr. M.S. Klein, a Mount Sinai resident, and Dr. J. Wanser, a Mount Sinai intern neurosurgeon, performed the surgery. When it was completed, Dr. Holland told Phyllis and her parents that it was a complete success, that she was cured of the single aneurysm, and once she recovered from the surgery, she'd be able to lead a normal life. Phyllis was discharged from Mount Sinai Hospital on November 25, 1975. Immediately upon discharge, Dr. Holland was unavailable for consultations, so Phyllis saw his associate, a Dr. Quinones, a few times for follow-up care. Eventually, Dr. Holland became available, and Phyllis continued to see Dr. Holland for follow-up care. 8 months after the operation, Dr. Holland sent Phyllis back to Dr. Carlin to have an EEG performed, a test of brain waves. That test proved to be normal. Phyllis and I were then married in June 1977. On June 10, 1981, approximately 5.5 years after the operation, Phyllis, accompanied by her mother, went to see Dr. Holland specifically for the purpose of determining whether it was safe for her to become pregnant. Dr. Holland examined her in his office, and he told her that it was safe for her to become pregnant. Phyllis eventually became pregnant, and in November 1982, she gave birth to our son. On March 18, 1984, all of a sudden, Phyllis lapsed into a fatal coma due to a massive cerebral hemorrhage. I called 911, and the paramedics took Phyllis to St. John's Hospital in Queens, where she was put on life support. After calling the family, I called Dr. Holland. Dr. Holland's secretary informed me that Dr. Holland had just died 5 days earlier on March 13, 1984, from cancer at the age of 62, so she sent me a copy of his medical records. The medical records I received were Dr. Holland's operative report, Dr. Klein's report, and Phyllis's checkup sheet with Dr. Holland. I took one look at the reports and saw that there was something seriously wrong here. Dr. Holland listed 2 aneurysms as a preoperative diagnosis, indicating that they both showed up on the Mount Sinai angiogram, and not one, as he had told Phyllis and her parents. He did say there was the one large aneurysm that he had clipped, but he also said there was a second smaller aneurysm that was further up on the artery, and that one he had wrapped with muslin, which is cloth. In addition, Dr. Klein's report varied from Dr. Holland's. Dr. Klein's report stated that the angiogram showed one aneurysm, the large one, and then he states that the second smaller one was discovered during the surgery and then wrapped with muslin. In addition, his report varied procedurally from Dr. Holland's report. Dr. Holland stated that he wrapped the smaller aneurysm with muslin first, then clipped the larger one, whereas Dr. Klein says the larger aneurysm was cleared, was his exact words, and then the second smaller aneurysm was discovered during the surgery, and then it was wrapped with muslin. So these two reports conflicted, and something certainly did not seem right about the whole situation. At the same time, Phyllis's brother's father-in-law was a medical doctor in the community, so he arranged to have a neurologist that he knew examine Phyllis. He examined Phyllis and told me that she was brain dead, that it was a massive cerebral hemorrhage, and she had no chance whatsoever of recovery, and Phyllis had already been put on life support. I then gave him a copy of Dr. Holland's medical records. He read them, took me aside, and said that he suspected medical malpractice, as Dr. Holland didn't state in his report as to why he didn't clip the smaller aneurysm, and he also said that Phyllis should have been angiogrammed prior to Dr. Holland recommending pregnancy. Phyllis passed away on April 5, 1984, and I arranged to have an independent autopsy performed at Albert Einstein Medical College in the Bronx. I had spoken to Dr. Boyce Bennett, the head of pathology, and sent him a copy of Dr. Holland's medical records. The autopsy was completed on May 9, 1984, and the cause of death was determined to be from the rupture of a giant berry aneurysm on Phyllis's right internal carotid artery. The neuropathologist that determined the cause of death was Dr. Harupian. When I received the report, I gave Dr. Harupian a call. The first words out of his mouth were, "Why are you doing this? I don't like to testify." I then explained to him that for all these years, we had been told that Phyllis had been cured of a single aneurysm, and now all of a sudden, Dr. Holland passed away 5 days before she lapsed into a coma, and it turns out she has 2 aneurysms. So I wanted to know what exactly happened to her. That's when he explained to me the time bomb effect of Dr. Holland's operation. He told me that the clip cured the larger aneurysm, it put pressure on the smaller aneurysm, and muslin became part of the arterial wall, yielding a single giant berry aneurysm that was growing on Phyllis's artery for 8.5 years from the minute Dr. Holland clipped that larger aneurysm. Furthermore, neither Phyllis, her immediate family, nor her personal physicians had any idea whatsoever that that aneurysm had even been diagnosed, treated, and was in fact growing on her artery for all those years.